Hello, welcome to the next part of our program. I'm Steve Anderson. I'm a neuropsychologist on the Parkinson's disease team at the University of Iowa. I'm going to talk to you now about neuropsychological rehabilitation. This might be a term that some of you are familiar with. Some of you might know about neuropsychology, but not neuropsychological rehabilitation. But this is a field of clinical care that involves the use of cognitive and behavioral methods to optimize brain health in Parkinson's disease. And I'll take that apart a little bit. Cognitive means thinking abilities. So we're using mental abilities, psychology, and behavior. What we're not using here are drugs. This isn't physical therapy. This isn't occupational therapy. It's psychological intervention. These interventions target cognition, by which we really mean thinking abilities. And I'll say more about details of this. We target emotion and behavior. The interventions are evidence-based. That means there's a scientific basis behind what we're doing. This isn't stuff we're just making up as we go. And these interventions work in synchrony or in harmony with all of the other Parkinson's therapies. This isn't something that you do one or the other. This really complements other interventions. The primary goal of neuropsychological rehabilitation is to establish daily behavioral routines that are going to optimize to make as best as possible brain health, cognition, and emotional well-being. We start from this idea, which is sort of a universal truth. We are all the same in many ways, and yet we're all very different. And this is true with or without Parkinson's disease. And in this context, these interventions involve, first of all, addressing factors that affect everyone. They impact on something called neuroplasticity, which I'm going to talk about in a minute. They impact for all patients. And these are things like regular exercise, social engagement, stress management. And then secondly, we take on specific problems that arise for an individual patient. So there's sort of this foundation of universal factors that affect almost everyone, and then details that may or may not affect an individual. We start really from an educational framework with the idea that understanding is really empowerment. Attending or participating in neuropsychological rehabilitation, it's very similar to taking a brief class. And by you throughout this, I mean the patient and family care providers. The focus is obviously on the individual with Parkinson's disease, but as you all know, this is a disease that affects not just the patient, but also the family. So the participants in neuropsychological rehabilitation are going to learn specific information. One thing that we focus on is understanding your own individual cognitive strengths and weaknesses. And we get at that from the neuropsychological evaluation. Very importantly is that we focus on understanding the links between your daily behavior and the functioning of your brain. This is something that may not be intuitive or obvious, but it's really at the heart of what we do. And that's the fact that what you do day in and day out really affects the expression of Parkinson's disease, how it affects you and your body and your mind. And we're going to come back to this idea. You're also going to learn strategies, techniques, and what we might call exercises to implement in your daily life. Getting better on these fronts, it doesn't happen automatically. It requires labor. So you are the driving force in neuropsychological rehabilitation. This isn't something where we therapize you. The whole rationale underlying this intervention is really to activate tools that you already possess, biological tools and psychological tools. And this requires work on your part. We do not know any easy way to do this. We don't do it to you. The therapist, the neuropsychologist or counselor really serves as an educator and more of a coach. And you're the star. You're the primary team member, and you have to make it happen. You're the one who's there 24/7. So we work from a cognitive behavioral framework. And let me just explain what this means. We begin with the idea that we will change cognition, change thinking abilities. And this is a great way to approach Parkinson's disease because, generally speaking, the reasoning abilities housed in cerebral cortex are a strength in Parkinson's disease. So we use that as sort of an inroad to the rest of the brain, to the mind. So we start with this idea that if we can change cognition, if we can uh, get an individual to accept the idea that certain behaviors are necessary, to recognize that, say, the negative impact of certain thoughts, by changing cognition, we in turn change behavior. So we need to change behavior to drive brain changes. Changing cognition also can change emotions. Negative emotions are part and parcel of Parkinson's disease. Nobody is ever going to say it is a good thing. It causes distress very naturally. It can cause depression. It can cause worry and anxiety. And that's natural and that's okay. What we want to do is not let those emotions sort of drive the bus. We want to put them in context. We want to control them. So by thinking about these things, by thinking about sort of the perspective that one takes on this, we can change behavior. And that might be as simple as getting up and going for a walk every single day. We can change emotion, and that might be as simple as not allowing oneself to get caught up in worry. And in the end, what we're doing really is changing brain health. All right. Now, very reasonably, you could ask, well, how does that happen? How is going for a walk or not worrying? How's that really going to change my brain health? And you're right to ask that question. But I will say this is some of the most solid science that we actually have about this disease. Let me start by saying it changes because your brain is plastic. And you're saying, well, your brain isn't made out of plastic. Okay, your brain's made out of, proteins and lipids and chemicals, just like the rest of your body. The brain is an amazing thing, though. It weighs only about 3 pounds, and most of that is water. Yet this organ, it's the foundation of our thoughts, our memories, our emotions, in addition to things like controlling movement and balance and other body functions. So plasticity, or sometimes referred to as neuroplasticity, is a really important concept. What it refers to is the brain's the capacity to alter its structure and its function in reaction to experience, also in reaction to disease. We know that the brain adapts very well to Parkinson's disease. Parkinson's disease is often brewing for quite some time before it shows up in symptoms. But what we want to focus on here is a different aspect of plasticity. And you could think of this in terms of things like learning. When you learn something new, if you learn somebody's name, you learn a new word, you learn a new fact, there is necessarily a positive change, a physical change in your brain. There's no other way that happens. And that's plasticity. So the building block of the brain, and you have to humor me here for just a couple of minutes. I want to take a little tour of neurophysiology because you need to understand how changing your behavior and thinking really affects this disease. Because here's the thing about what we do is that you as an individual have to buy into this because as I said earlier, it requires labor. It requires you to do stuff. And if you don't believe that this is true, if you don't believe that exercising and good sleep hygiene and stress management, things we're going to talk about here, if you don't believe they're going to help your cognition, then you're not going to do the things that are necessary. So that's why it's important that you understand at sort of a basic cellular level what's happening. What are you doing when you engage in these good behaviors? So the basic building block of the brain, of the mind, is a neuron. It's pictured here. There's sort of a complicated structure. We have a lot of them, about 100 billion neurons in your brain, and each of these has thousands of connections. And when there's a change in brain function, so if we learn something new, what's happening there? One is that there's a change in the neuron activity, a change in how one neuron will fire and talk to another neuron, keeping in mind it's connected to thousands of others. And ultimately, there are changes in the actual structure of the neurons. So neuroscience has identified really a small number of factors that are really important for influencing plasticity. And these factors influence plasticity in all people. They are particularly important in Parkinson's disease. Okay, these are factors that are associated with positive functional changes, meaning things get better, things work better, and physical changes, both in individual neurons and in neuronal networks. So if we look over here, we have two neurons, and you can see they have sort of this branch-like structure. And if you look at the neuron on top, it's a little bit sparse, right? And it has some branches, but compared to the one on the bottom, this one is nice and big and bushy and lots of branches. And if we go further under the microscope, we can see it has all these little buds and connections coming off of it that the other one doesn't have. So what's the difference between these two neurons? This is a neuron of an animal that was in an enriched environment. This is an environment that presents challenges, mental challenges, problem solving, physical challenges. It's demanding activity. This is the type of neuron which you will see when two animals are allowed to cohabitate, when two animals are allowed to interact with each other, as opposed to an animal that's forced into isolation. This is what you want. We want big, bushy neurons with lots of connections to others. We want connections across different parts of the brain in these neuronal networks that are strong, that are robust. And these are the changes, physical changes that take place by doing the right things to enhance plasticity. All right. So going back, we said our goal is to optimize brain function. We have these foundation issues as number one. What are these? What are some of the key factors that we're talking about? One is cognitive stimulation and challenges. Your brain loves a challenge. When you're learning something new that's good for your brain, being mentally active. If that's doing crossword puzzles, if that's playing bridge, if that's reading books, if that's building birdhouses, but you want to be mentally active. You want to be physically active. You've heard about this in other places today, but physical exercise is one of the best things that you can do for your mental abilities. We want to be socially engaged. We are social animals. Our brain responds to social interactions. It's difficult in this age of a pandemic, but we want to be socially engaged. Social isolation is poison to the brain. And stress is a very bad thing for Parkinson's disease. I think almost all of you know this already. Stress makes just about every neurologic symptom worse. If somebody has a tremor, it gets worse under stress. If somebody has trouble coming up with words, it gets worse under stress. Stress isn't something that floats out in the air. We have this very well-defined biological stress system, so managing that is extremely important. Last on the list is good sleep hygiene. Good sleep is important to good cognition. All right, we said on this foundation of things that are good for everybody, we then also address specific problems that might arise for an individual. Okay, individually tailored interventions. We identify specific goals. What do you need? What are the problems that you're dealing with? This is a collaborative process. It involves the individual with Parkinson's disease. It involves family members. It involves the neuropsychologist and other members of the care team. What are the things that we need to address? Sometimes the targets are identified by the neuropsychological evaluation. So this might be problems with aspects of cognition like memory or visual spatial abilities. It might be things in the realm of mood, such as anxiety or depression. It may be behavioral problems. Apathy can be a big problem. Amotivation, where it's hard to get up out of the chair and do things. Sometimes the opposite occurs, and there are impulse control problems where somebody has trouble controlling behaviors, doing things they ought not to be doing. Most often, these targets are identified by real world experiences. What are you dealing with in the real world that we need to try to address? Stress and anxiety management is good for just about everybody. We recommend regular practice of body and mind-based techniques. So these are things like progressive muscle relaxation. You can see in the diagram here, it's tensing and relaxing muscles in a particular way. This is combined with positive mental imagery, imagining yourself in the most relaxing place you can be, if that's at the lakeside or on your back porch, and controlled breathing. So these are things that they're very simple, but with some basic training in these, what you develop is a very powerful relaxation response. And this is something that you can do every day, just like meditation, to sort of bring down the overall tone. And it's also good for an instantaneous whole body response when you're facing a stressful situation. If you have to go into a public place where you know the stress may worsen symptomatology, this is something that you can do in the car before you go in. There's a little asterisk here. This is good for everyone, including care providers. As another example of what specific issues might be addressed, it might be memory problems. We are not good at building up memory like a muscle, but oftentimes there are compensatory strategies that can be used. Better organization, simple things like making lists. We have all kinds of electronic devices today that can be very useful. And sometimes there are strategies that can be useful for learning new information, say in a workplace, or memory in specific settings. And a last example here is attentional problems. It's not unusual for attention to take a bit of a ding in Parkinson's disease, and that can cause problems. If one is not attentive, it could be easy to, say, fall on the stairs, or it might be easy to cut oneself with a knife in the kitchen. So this idea of training oneself to be mindful or focused on the current situation can be very helpful in reducing accidents and errors. And this is an example of a specific problem that could be addressed for individuals with attentional difficulties. So, lastly, I just want to say this is always a journey for patients and for family members. We always come back to the ancient Stoic philosophers with this idea of acceptance and adjustment. Most people have heard some version of this at some point, but the issue is, what then is to be done? We make the best of what is in our power, take the rest as it naturally happens. By that, we mean there are aspects of Parkinson's that are out of your control. There are things that are happening because of the disease progression. And those things need to be accepted. There are things that are not going to be changed. But directing your energies to those aspects of your behavior, of your thought processes that you are in control of, it's a powerful tool, and it can very strongly influence the course of the disease. So, in conclusion, drawing on neuroscience, drawing on psychological research, neuropsychological rehabilitation can help guide individuals with Parkinson's disease and their families as they address the psychological, the behavioral, the cognitive, and the emotional challenges presented by Parkinson's disease. And very importantly, individuals with Parkinson's disease play a crucial role in optimizing their own quality of life and the impact that the symptoms have by structuring daily behavioral routines and cognitive habits in a way that optimizes brain health. So you're carrying a lot of the weight out there, and we want to help you with that. And I will stop there.
Dr. Anderson, the question is a very good question. How do you motivate a person with Parkinson's to keep moving and doing things?
Yeah, that's a great question, because something that often isn't appreciated is that a lack of motivation, often is a consequence of Parkinson's disease. So, and it can be a very serious one, because if people stop doing things, it's not hard to predict what effect that's going to have. So it's really important to try to stay motivated and to recognize that diminished motivation could be part of the disease. Everybody deals with motivation, right? We have an epidemic of obesity in our country, right? So it's not that it's easy for people to do things like exercise. These, no, as Dr. Uch said, exercise is one of the best things you could be doing. So how do we deal with difficulties with motivation? A few simple things. One is involve somebody else. So partner involved. It's always good to have a teammate. This is a time when it's good to have a nagging spouse. Okay, somebody can kind of give you a little kick in the pants. Schedules. A regulated schedule can be very good. So at 10 o'clock, we are going to go for a walk. Between 3 and 4 is the time I am going to play the piano. But have a schedule and stick to it. That's easier than sort of free form as the day goes by. Review what we've talked about here today. Sort of be your own therapist. This stuff is important. So you're sort of being your own therapist. Review this. You're going for a walk because it matters. You're picking up that book because it matters. And the last thing I'd say is make it fun. This doesn't have to be drudgery. The things that are good for you are mostly things that can be enjoyable. Find an exercise routine that you like. If you don't like doing crossword puzzles, don't do crossword puzzles. Do something that you like. All right. There's nothing magical about one specific exercise or one specific cognitive activity. What's important is that you're doing something.
Thank you very much. I would like to continue with you. There is another specific question that states, should I be doing those brain training games I see advertised? Will this help my memory and thinking?
All right, I'll circle back to what I just said. Yes, you should do them if you like doing those types of computer games. If you don't like doing computer games, don't do them. You need to do something to stimulate your cognitive activity. Your brain loves a mental challenge. So it's much like Dr. Uch said with exercise. The evidence is not strong yet that any one particular mental exercise is better than any other. We know that mental exercise is good, so do something.